Welcome, everyone. Glad that you could join us so that we could bring to your attention the issue of private well drinking water safety. My name is Gavin Kennedy. My co-presenter's name is Gordon Check. Gordon and I are both hydrogeologists with the province of Nova Scotia who have been engaged on the issue of trying to improve private well water quality safety for a number of years in our respective roles. So let's get right to our challenge. Gordon?
Our challenge to you is to improve private well drinking water safety. To summarize the issue, almost half of Nova Scotians rely on private wells for their water supply. A number of bacteriological and chemical contaminants are commonly found in our groundwater, and most of these are naturally occurring. Testing and treatment of private well water is the responsibility of the well owner and is voluntary. So here in Nova Scotia, there are no regulatory requirements to test or treat private well water. As a result, few well owners regularly test their well water quality, and about half have never tested the chemical quality. Unfortunately, in our work, we have found there are a number of significant barriers to testing and treatment. Therefore, as a result, many private well users are drinking unsafe water, which can lead to illness and disease and incur costs to the healthcare system. So, what are private wells? These are privately owned water wells that supply household domestic water. This is the water that you use for drinking, cooking, flushing, bathing, and so on. In the Atlantic provinces, private wells tend to be deep drilled wells constructed in bedrock aquifers, or shallow dug wells constructed in thin layers of sediments overlying the bedrock. As noted earlier, it is the responsibility of well owners to ensure that their water is safe to drink and to mitigate any potential health risks, which usually involves water treatment. About 42% of Nova Scotians obtain their drinking water from private wells. This represents about 197,000 wells, or 386,000 people. Across Atlantic Canada, the percentage ranges from about 20% in Newfoundland and Labrador to 50% in PEI, which is considerably higher than the Canadian average. In Canada in total, there are about 3 to 4 million people who use private wells. And in the US, it is estimated that about 45 million people use private wells. Globally, about half of the world's population relies on groundwater for drinking water, much of which is sourced from private wells. This heat map shows the density of private wells across Nova Scotia. As mentioned earlier, there are over 197,000 wells, and most of these are located in suburban areas outside of the province's major cities and along the coast. Common contaminants in Nova Scotia groundwater include bacteria, manganese, arsenic, lead, and uranium. It is estimated that more than 30% of Nova Scotians have levels of one or more chemical contaminants exceeding Health Canada's health-based drinking water quality guidelines in their untreated well water. Manganese, arsenic, and uranium are naturally occurring and can be picked up from rock and sediment as groundwater flows through these materials. Other Atlantic provinces, especially New Brunswick and Newfoundland and Labrador, have similar naturally occurring contaminants of concern. In terms of bacteriological quality, it is estimated that more than 25% of private wells in Nova Scotia have total coliform bacteria in their well water. Gavin is now going to talk about the relationship between these contaminants and disease.
Yeah, so various studies in the province have shown a relationship between body burden of contaminants such as arsenic, lead, and uranium, as measured in biomarkers such as toenail or hair samples, and the levels of these contaminants in private well drinking water. The relationship between exposure to contaminants in well water and disease is complex because we're usually talking about persistent, low-level, non-acute exposures. Nevertheless, researchers have shown that an increased risk of bladder cancer Potentially kidney cancer was associated with exposure to arsenic in Nova Scotia private well water. Age-standardized incidence rates of bladder and kidney cancer in the province are 4 to 14% and 28 to 46% greater, respectively, compared to the national average, based on last year's cancer statistics. In addition, it's estimated that there are over 7,000 projected cases of acute gastrointestinal illness every year in Nova Scotia due to exposure to Giardia, Cryptosporidium, Campylobacter, E. coli, or norovirus in private well drinking water. Next, we'll explore some of the reasons for exposure to these contaminants in private wells. Although in most cases conventional treatment options are available, private well ownership can be complex, and exposure can occur due to a failure to implement the necessary action at any given stage of private well stewardship. So, assuming a private well is used for drinking and a contaminant is present, if the water is not tested, the private well owner will be exposed because they are less likely to implement any mitigation. If the water is tested, but the owner can't afford mitigation, such as a treatment system, or decides it's not necessary, again, the private well owner will be exposed. Finally, if a mitigation is implemented but it isn't appropriate or effective, the private well owner will once again be exposed. An example here would be the malfunctioning of a treatment system. So in terms of well testing behaviors, it's estimated that more than half of private well owners have never tested the chemical quality of their water. And less than 10% of private well owners follow the province's recommended frequency for bacteriological testing, which is every 6 months, and chemical testing, which is every 2 years. These testing rates are a concern because testing is a critical determinant in motivating private well owners to take action to reduce exposure risk, especially because many contaminants have no objectionable color, smell, or taste. The following chart summarizes reasons stated for not testing during a phone interview conducted about 6 months after a site visit to educate well owners about water well stewardship. This information was collected as part of the province's Environmental Home Assessment Program, which ran from 2007 to 2015. Ignorance, complacency, procrastination, cost, and inconvenience are commonly cited as barriers to water testing in Nova Scotia. The most common response was along the lines of, "I'm planning to do it soon," but this answer is likely skewed by the fact that homeowners had been personally visited and wanted to appear responsive to the program. Some of the common answers we've heard when private well owners are asked why they don't test their well water include, "It's too expensive to get water tested. We're a working family and it's just too inconvenient. I'm planning to do it but haven't got around to it. Just too busy, too much of a hassle." Or, "I know arsenic is a problem in Nova Scotia, but it's not a problem on our road. None of our neighbors have ever mentioned a concern." Or, "We've been drinking this water for years and never had a health problem. My water tastes fine." Or, "At our age, it's too old for it to be harmful." Research has shown that there are differences in terms of the social vulnerability of private well owners to exposure to drinking water contaminants in their wells. Well owners at higher income and education levels are more likely to implement protective behaviors to reduce their exposure, such as testing and treatment of well water. Traditional testing promotion activities also tend to be of more benefit to these well owners, as they have more capacity to receive and act on public health messaging. There are also inherent biological vulnerabilities associated with exposure to private well water contaminants. Population groups such as children, fetuses, and pregnant women are more vulnerable to the impacts of unsafe water. There does not appear, however, to be a strong relationship between these populations and the implementation of protective behaviors that would reduce their exposure. So the current approach by the province to manage public health risks associated with private well drinking water contaminants is to raise risk awareness through the publication of risk map web applications, fact sheets, and websites, and also to provide advice to well owners on how to test and treat their well water. The same approach is used in almost all jurisdictions, not just Nova Scotia. Next, Gordon will finish with a summary of the issue.
So here's our call to action. Many Atlantic Canadians are drinking unsafe water from their private water wells, and so improving the rates of testing and treatment will have significant benefits with respect to disease and illness prevention. Some of the key barriers that need to be addressed include: 1, the availability of easy to understand and localized risk information to raise risk awareness levels. 2, the affordability and convenience of water testing. 3, the capacity of private well owners across socio-demographic levels to conduct a water test, interpret results, and to select and maintain treatment equipment. And 4, the affordability of the purchase and maintenance of treatment equipment. The development of innovative tools, apps, or instruments to lower any of these barriers could have a beneficial impact on the health of private well owners. So, just to wrap up, let's review the 3 main takeaways. 1, almost half our population in Nova Scotia relies on private wells. 2, most of these wells have not been tested, and many of them are not safe to drink from because of contaminants in our groundwater. 3, drinking unsafe water causes illness and costs to our healthcare system. We need to improve private well drinking water safety by finding new ways to get people to test and treat their well water. We will leave you with a quote from Nova Scotia's Chief Medical Officer of Health. The best way to protect yourself and your family from exposure to bacteria and chemicals is to test your well water regularly and treat it when needed. If you're interested in taking on this challenge, there are a number of relevant data sets and other resources available. Please contact Gavin or Gordon, and we can provide a current list. Thank you.